Welcome to the last section of things that are going to be helpful to you to be successful in the program. We're going to look at several things here, how instructors and other students can assist you, and just some general things about general learning theory and some of the things that you're going to encounter as you move through the program. The instructors in the program, myself and Larry, want you to be successful, and we want to do whatever we can to help you be successful in the program. So no matter what you may hear, see, or other people may convince you of, it is our interest that you be successful in the program. The important thing to think about with that, or to be aware of with that, is the fact that it's up to you to put in the effort. Again, we've said many times that we cannot force you to learn anything. That is up to you. You have to put in the effort. You have to be willing to do the work you need to do in order for the instructors to help you. So your part is to do the reading, put in the time, put in the effort, work at learning and understanding the material, ask the questions when you're unclear on something, but do your part. The office hours are posted, but in general our office hours are basically any time that we're not in class. If we're not in class and we're in our office, we are accessible, the doors are open. The desire, once again, is to assist you in any ways that we can do so. There will be, and you'll get some information about this, there will be available to you enrichment labs, additional time that Larry or I or Amy or one of the other people that helps with the program will be available to help you, to answer questions, to demonstrate things, to give you that opportunity to make up any labs that you miss due to illness. And again, I cannot emphasize enough, ask questions. That's how you learn. One of the most valuable tools, one of the most valuable abilities that you should learn from this program is an inquisitiveness, a very acute sense of questioning. You learn by asking questions. Your instructors will also assist you in any way they can with learning the information, learning the skills and techniques that you will need as a respiratory therapist. A common thing of human nature is that we assume people understand and know things unless we have some information or indication that shows that they do not understand. So, again, to initiate this process, as I've said very early on, I'm not a mind reader. I'm not very good at picking up on subtle hints. I'm not that good at obvious hints. Make the contact, ask the question, request the assistance that you need. There's no real formal advising process here at DMAC that is established, but basically Larry and I are your advisors. As you proceed through the program, if there's any point in time where you are thinking about making a change, dropping a class, doing anything like that, it's not that we want to talk you out of doing something. It's not that our desire is to get you to change your mind about something. Our desire is to help you make the right decision, help you have the right information you need to make those decisions. It's not our place to make them, but it is our place to make sure you have the information you need. Dropping a class, even if it's not a respiratory therapy class, may have an impact on your ability to continue in the program without having to stop out and pick up a class before returning to the program. So please visit with us. Let us know what you're thinking. We'll share some information and thoughts and simply provide the information that we believe you need as you consider any changes that you may make. Any difficulties you're having, anything that affects your ability to learn is something that we want to know about, and we want you to stop in, catch us, talk to us at some point to let us know what's going on. The other students in the program can also be a big help to you. You can form study groups, people that maybe live in the similar areas, have similar interests, seem to be people that you have a connection with. If you can get together with a group of people and quiz each other and review information, it can be extremely helpful. There are a number of students in the second year group who are very interested in helping. There are some formal methods of setting up tutoring for any classes in which you would like additional assistance. Those are sometimes cumbersome. There are people who are very interested and willing to do this on a volunteer basis without any cost. So talk to me, talk to some of the second year students. People are there, people are interested in helping you. So those who've already had the class in the second year can be a big help. As I said, there are tutoring opportunities, some formal, mostly informal, that will be available to you. You can quiz each other about the information. You have been provided with some sample tests from previous years. Those can be helpful, but they're not everything you need. Just simply taking your objectives, taking information that has been covered in class recently, and quizzing each other over that material can be a very helpful way to learn. Discussing with other people the information that you're learning in class. The more you can use, discuss, talk about that information, the more firmly it gets implanted into your brain and into your memory. After you've completed the assignments, you're certainly not encouraged to share assignments to reduce your work, because again, that can be done. I know it's possible. I know it probably has been done by some students in the past, but you're the one who loses out. The work of doing the assignment, of finding the information, of synthesizing the information together, that's a big piece of where some of this learning occurs. But after you've completed an assignment, whether it be math assignment or anything else, if you want to sit down and compare the information you found with another student, that can be a very helpful way of helping to make sure you have the complete information, the right information, and it can provide an opportunity to just talk about it and again explore the information that you have found. You have the opportunity every time you're in lab to work together with other students as you're going to be learning the information, working with the skills, working with those abilities. Each and every time that you are in the lab, you can be working together with other students. It's nothing, again, people have said, you need to hear again, there's no competition within the program. Your grade is not based on how anybody else does. Your grade is based on how you do. So the more you can support and work together with each other, the better it will be for everyone. You're going to learn a lot of skills, a lot of techniques, a lot of patient care abilities. Practicing those, working with them together, having a group of 2 or 3 people, one to be a patient, one to be the therapist, and ideally one to sort of observe, watch the check sheet of the steps that you're supposed to be fulfilling, and then provide you feedback at the end on how you did with meeting each of the steps of the procedure is the way to learn it. It's what I've said before. You cannot learn to ride a bicycle by reading about riding bikes. You can't learn to perform arterial puncture by reading about arterial puncture. There's some things you need to learn from reading. There's some things you can learn from watching an expert do it. But for you to develop that skill requires actually performing the arterial puncture. So as you are being the patient, it's very easy to guide the person practicing the technique because you know or are quite familiar with what the steps are that they're supposed to be completing. So, the person getting ready to do aerosol therapy and you as the patient sticking your arm out to them to remind them that they need to check your heart rate and breathing rate and some of the other vital signs is not really helpful in the long run to their learning and remembering how to perform the steps of that procedure. The other thing is, it helps the person to give proper instruction if you try to approach your role as the patient from the standpoint of, I really know nothing about this therapy. I'm a brand new person to the therapy. I don't take deep breaths and hold my breath unless the therapist person in the practicing actually instructs me to do so. And realistically, the best way to learn something is actually to teach it to someone else. Throughout most of my college career and my early education in respiratory therapy, one of the more confusing things to me was the autonomic nervous system, that involuntary system that we have. There are lots of chemicals and lots of things that go with it. And I was asked to do a presentation, an in-service presentation to the respiratory therapy department where I was working, because it would help understand and help the staff to better understand the drugs and the medications that we were administering to patients. And it was really the first time that I firmly had the concepts of that autonomic nervous system in my brain that I could bring back whenever I needed it, was when I taught it to somebody else. So again, teaching it. If you have a dog or a small child that doesn't roam off, you can teach the information to them. They don't have to comprehend it or learn it for you to gain the benefit of teaching that information. Just a real quick kind of overview of some of the important things that we'll be dealing with as we go through the program. There are some basic domains of learning. When we had our information sessions, I talked about the fact you're going to learn in different types of settings. And there's different types of knowledge that you're going to gain. There is the cognitive domain. That's the information that you know, what you learn, facts and figures, general rules, the patterns that we see in somebody that has a breathing difficulty. All those are cognitive knowledge. So facts and figures, normals for various lab tests, what a chest radiograph should look like. Those are the cognitive domain. Psychomotor gets more into what you can do, and these are the skills, those physical skills and procedures that you're going to learn. They require manipulation, they require performing of techniques. It's when you're working with equipment and supplies. So all the things that you're going to do in your labs generally relate to the psychomotor domain, but they also support that cognitive domain, because hands-on things can help you learn all of the data that you need to know and all of the way the devices work. But the psychomotor is the skill of actually working with them, manipulating them, getting them to do what they're supposed to. Equally important to those two domains of the what you know and what you can do is really how you react to things, the affective domain. People do not get fired from jobs in healthcare because they don't have the knowledge or the skills. They lose jobs because they don't react properly, they don't interact properly with other people. So this really gets into your attitudes and the ways that you react to things, how your emotions affect the way that you behave with other people. A lot of this is going to be determined by your past experiences in life. It's really and truly a reflection of what's going on inside, internally, your emotions, your attitudes, your ways of reacting to what happens to you fall into this affective domain. And you're going to have things that we're going to do throughout the program that are going to impact all three of these domains and your learning in them.